Welcome everyone to Charting Paths to Prevention, Mapping Social Vulnerability and Alcohol-Related Deaths. I'm Nicole Shaneborn, and with me is Dr. Beverly Triana Tremaine. We'll be your speakers for the day, and we'll let everyone kind of get comfortable and enter the room first. We still have some folks we're waiting on, but we're glad to have you all here today. All right, let's see how many folks we've got now. We've got 70. That's pretty good. So I think that we can probably get started. And I just want to welcome you all. What we're doing right now is putting in our names, where we're from, and our role. And I have Dr. Tremaine with me here today. So we'll be your presenters for the day. We are going to do a little interactive thing. So welcome to Charting Paths Prevention, Mapping Social Vulnerability and Alcohol-Related Deaths. And we have a blank map here. I know some of you have been putting, your state in the chat, but we just wanted to do something a little more interactive. So I'm going to let Wanda, if you want to talk to everyone about how they can annotate the map with where they're from.
So what we'll do here is we're going to annotate on the map where you are right now. Not where you want to be, but where you are currently, where you're serving. If you don't know how to annotate, go up to the top of the screen and you'll see view options or annotate. Click on that. And then over to the left, you click on the arrow, the stamp, and you can annotate where you are. You can choose your stamp that you want to use. I just put a check mark right in the middle of Oklahoma. I'm going to put a heart in New Mexico because that's where I'm from.
Oh, look at all the annotations.
All over the place. Look at that. That's so fun.
Mine isn't letting me annotate.
It isn't. So, do you see the option up at the top?
No, ma'am, I don't. It's not on my option. I don't have an option for that.
Mine, it's on the bottom left-hand corner. It's a little pin. And if you click on that, it'll let you annotate.
I don't even have that.
I don't have that either.
I don't either.
Wow. Okay, so maybe we have some different versions. Did you all sign in when you came in?
Yes, ma'am.
Makes a difference.
Yes.
All right.
I'm sorry. I didn't realize that wasn't an option for everyone.
That's okay. If you still want to put your name and where you're from in the chat, that way we get an idea of where you're from. But it is a nice visual. So those of you who are able to do it, thank you, because it kind of gives us a nice perspective of where everybody's at. And so our region that we serve with our PTTC is there in kind of the green color. And the data we'll be zoning in on today will be from that area, just to let you all know. But the methods we are using can be, translated to any other region. And so we just want to make you aware that this will be just for that region that we focus on with our PTTC. But that doesn't mean that it's not useful for everybody else here. And we hope that this can be replicated in other areas. So anyway, well, thank you all for annotating. And we see a lot of people from both our region and all over, which I always just love being part of the PTTC, so we can reach people from everywhere across the US. It's amazing. So we will go ahead and move on from here, but thank you for participating in that activity. And now we'll have to remove our annotations. Thank you. We definitely provided some color on the acknowledgement slide. I love it. So today, our views that we express here on behalf of our PTTC, we just want to let you all know that those are not the views of SAMHSA. So these are just views that and data we are presenting, but just want to acknowledge that SAMHSA is our funder, but they are not necessarily the views of SAMHSA or the Department of Health and Human Services. If you would like access to anything or you need copies of the publications today, our general website or our general email is pttc6@ou.edu. But we will also be providing my email at the end if you need direct contact for those things. So welcome again. Our learning objectives for today are we are going to examine the association between the Social Vulnerability Index and alcohol-related deaths in the South-Southwest region. And we are also going to look at identifying one way the data can be applied to assist organizations with prevention planning. And I do want to also point out in the chat, we will be posting information to our documents. So be looking in the chat for those documents as we go through today. Our data brief will be posted in the chat for you to look at. And so just keep an eye on the chat as well. So, and Sheila has posted that at the very top, but we'll be sending you that link throughout the presentation today so you get access to it. And there it is. Thank you, Sheila. So we're going to do some introductions, and then we will talk about how we went about mapping alcohol-related deaths and social vulnerability and our methodology, and then what we found based on that, as well as what you all can do as prevention professionals with this information. How is it applicable to you in your work? We'll also have a question and answer session. And of course, our evaluation at the end, which is always really important to us so we can hear your feedback as well as learn how we can improve and what you found useful and what other things you'd like to see from the PTTC. So we encourage you to fill that out. So I am Nicole Shaneborn. I am the evaluator for the South-Southwest PTTC in that region you saw earlier. I come from the field of both psychology and public health, and I've worked in public health now for over 20 years, doing training and technical assistance and evaluation-related work. And glad to be working with the Southwest Prevention Center now for around 12 years as starting out as a trainer and now an evaluator. So I also have with me Dr. Beverly Triana Tremaine, who is our epidemiologist. And I can't say enough about her extensive work on this project. She has been invaluable to the findings, the methodology, and everything else you will see here today. She is also leaving us. So we are, it's a bit bittersweet because this amazing work that she has done and then she's leaving. But I know our paths will continue to cross. And her legacy definitely lives on in all of our products and recordings. So we are definitely glad to have those with us. And Bev has, I don't even know where to begin on her bio, but she's been in public health for a very long time and also has worked with us for around 13 years. And so she also is an author. She's written the book Evaluation Time. She has her own consulting firm, Public Health Consulting. She has experience at the state level. The list could go on and on. But Bev, was there anything you would like to add to your background there?
No, that was awesome, Nicole. I enjoy doing these and excited to show this information to our guests today. So thank you.
Well, thank you for all your hard work. And I also want to mention that we don't have a lot of time today, but I'll do a quick thank you to our support team here
Yes.
today. Wanda West, our instructional design coordinator, Sheila Boswell, who has done extensive work on the graphics and design for the data brief, as well as our website. So we just really want to thank all of them. And Richard just makes everyone feel comfortable on these. So we know that if, I lose internet, he is there to pick it up. And so Richard is our technology guru. So thank you, all three of you, for helping out with today's Lunch and Learn. With that being said, it is a Lunch and Learn, so I will move a little quick through this compared to our normal webinars, but we will still be making this interactive. So I appreciate you all being here. So our variables that we concentrated on for this research are alcohol-related deaths, and we'll start out with that, and then we'll talk about the next one. But alcohol-related deaths have gone up. So last year we did some another project where we looked at alcohol-related deaths, and they had increased substantially from 2010 to 2020. And so this is sort of a continuation of that. While last year we focused in on women and alcohol, this year we want to take a deeper look into some other factors that may be going on. So alcohol-related deaths are a significant public health concern globally. Most of you know this because you're prevention professionals, but they do represent a substantial burden of morbidity and mortality in the work that we do. We have individual level factors such as alcohol consumption that we're very familiar with and health behaviors, and those undoubtedly influence these outcomes. But there is the role of broader social determinants, and that can't be overstated. So that's really why we're here today, is to talk about those other things. We have risk and protective factors, we look at social access, we look at some of those other things, but what else might be going on in our communities that's related to this outcome with alcohol-related deaths? So research increasingly suggests also that these alcohol-related deaths are not randomly distributed, but instead are closely intertwined with underlying social vulnerabilities and inequities. And we thankfully have been hearing a lot in the research lately about inequities, disparities, and it's just great. And so it's really the time for us to be talking about this. How is this related to alcohol-related deaths? So one thing I do want to ask is how many of you are familiar with CDC Wonder? And you can post your answers in the chat. See if anyone is familiar with that. Okay, so I'm not familiar. I've heard of it, yes. Okay, so we've got some different responses here. And so CDC Wonder is a publicly available data set from the Centers for Disease Control and Prevention. And Bev has posted the link there for you all to take a look at that. I encourage you to check it out. All the databases there, and there are multiple, not just associated with alcohol-related deaths. There are multiple databases included in this data set. And so it's a really rich resource for you to do that important step, right, of the strategic prevention framework assessment. So it's an existing data set. We don't have to collect this data on our own that is available to us. And with limited funding and things like that, it's always important to find those data sets that are free and available and already exist. So I encourage you to check it out. And so with that, it looks like we've got quite a few folks that are not familiar. And so I encourage you to check that out. And if you need some help walking through that, just let us know. We'll provide our contact information at the end. Today, we don't have a lot of time to go through steps.
Because
but-
we,
Oh,
we
sure.
just hit CDC Wonder and it will come up. The website, we just hit CDC Wonder.
Yeah, in the chat, Bev has posted a link there, and that should take you, Dr. Tremaine. Thanks, Kenya. Yeah, it's right there in the chat. You also can Google it, and it will definitely take you to the right place. Yeah, and looks like it goes straight to it. Perfect. All right. Well, thank you, Bev, for posting that. We're going to go ahead and move on to our second variable, which is the social vulnerability index. The SVI, and this one is a little less familiar to folks than CDC Wonder. So this is also a Centers for Disease Control database. And this is the other data set we used for our other variable, which is social vulnerability. And so this is a tool designed to assess your community's susceptibility to adverse health outcomes. This could be based on various social, economic, and environmental factors. It also provides a comprehensive framework for that evaluation we have to do and looking at evaluating vulnerability by synthesizing data on all those different factors that could be contributing to alcohol-related deaths. So those include things like socioeconomic status, household composition, minority status, and housing and transportation access. And so the SVI takes all these, it maps and quantifies these dimensions, and it offers insights into those structural inequities and systemic barriers that do shape our community's ability to withstand and recover from health crises. So one thing that I would like to talk about, a little background of the SVI. These discussions kind of began around 2006. And then in 2011, it was kind of formally established. So a lot of scientists making decisions about what is this going to look like? And it has had 4 iterations since then, but it really was designed to look at disaster preparedness and emergency preparedness and look at what communities are vulnerable both before, during, and after a natural disaster or another public health emergency. So when COVID-19 came along, there were studies that used the SVI during that process to identify communities who might be more at risk for not being able to get access to vaccines and access to medical care, those kind of things based on social vulnerability. So it's an important tool for us as public health folks to really look at when we have something happen, who's most vulnerable. And so we're translating this really to look at alcohol-related deaths. And can it be used for this as well? So that's kind of what today is about. But first, we want to hear from you and just talk a little bit more about how you think someone is vulnerable in their community, like in your own community. What makes someone vulnerable? So beyond those risk and protective factors, what other things do you think are impacting alcohol misuse? And so Sheila has posted that question in the chat for you, and we'd love to hear from you a little bit. And I'll give you a second to respond to that. Their environment, lack of employment, social media, social groups, trauma, family and supports, insecurities, accessibility, broken home, loss of family. Very good. And a lot of those are encompassed in some of those factors you see up there on the first bullet. You know, your household composition, transportation and housing. You know, sometimes access to daycare, right? To be able to go to the doctor, we might need daycare assistance. Experienced tragedy, ageism, genetic factors, grief. Wow, y'all are doing amazing. So these are things that contribute to alcohol-related deaths that might make someone vulnerable. It doesn't mean it necessarily would happen. It just makes that person maybe a little more vulnerable, or the community more vulnerable to adverse health outcomes. Great work. And as Dr. Tremaine said, that's an excellent list of upstream factors. Yeah, isolation. There's been a lot of research lately on, loneliness and how that contributes. So, great list. ACEs as well. Yes. All right. Well, I'll just turn it over to y'all because I think you guys could handle this presentation, but we'll move on with it. So thank you for your participation. All right, so we got into this a little bit already, but the purpose of our brief today is we're going to look at the association and interplay between social vulnerability index and alcohol-related deaths in the South-Southwest region. And if you would like, in your chat, we have provided the link to our webpage and data brief, so you can look at the more detailed information about how we did everything today, because we definitely won't be able to cover everything in a short lunch and learn, but we did include that data brief there for you for your reference. We also want to look at identifying avenues for focused intervention and policy development. And we also want to bring a deeper awareness of the relationships between social vulnerability, alcohol-related deaths, and social determinants of health. So this information all really underscores the importance of adopting that comprehensive and equity-focused approach to alcohol misuse prevention. So we usually see, we have our strategic plan, right, where we're going to do this strategy, this strategy, this strategy, and that's all going to help us reduce alcohol-related outcomes, right, adverse alcohol-related outcomes. And so what this says is, okay, great, we've got those strategies, but how do we infuse the work around equity and social vulnerability into those strategies as well? How do we make sure what we're delivering is also equitable so that we can get the best outcomes from our work? And so that really is the meat of why we did this, is we want you to have the information so you can understand at that deeper level how these other factors may be at play. All right, so this breaks down the social vulnerability variables a little more on the SVI. And so you can see, I'm not going to read all of them, but you can see for the four main factors, you have socioeconomic status, household characteristics, race and ethnic status, and then housing type and transportation. You can see all the more specific variables underneath those that were included based on the science and research that has been done on the SVI that may be contributing to adverse health outcomes. So all of these things are things that are highly related to having adverse health outcomes. I also want to point out that the race ethnic status characteristics, those are included in the SVI specifically due to the health inequities experienced by groups. So like access to healthcare and things like that. This does not mean necessarily that if someone has a specific characteristic, they will experience an alcohol-related death. Remember, this just makes the probability more likely because they might be more vulnerable. So, all right. We will move on now to our next big topic, which is our methodology. So the methodology behind this was quite extensive. There's a lot of data. And again, I can't say enough about the work of Dr. Tremaine because it was very tedious, and she did an amazing job working through all the ins and outs of this. So with ARD, which is the age-adjusted alcohol-related death rate per 100,000, that was used to calculate the ARD variable. And then in order to determine if it was an alcohol-related death, we use the International Classification of Disease and Death, which some of you may know as ICD-10 codes. And those codes specifically were X45, X65, and Y15. And so those are related to anything like alcohol poisoning and all other alcohol-induced causes. So when you get into CDC Wonder, it's going to give you death data, but you have to specifically query based on certain death codes to get the extracted data that you need for this particular method. So that's what that means. And then we developed a composite score for the 16 social vulnerability factors. And so that was our main way of drilling down all this data to look at the relationship. Our analysis methods, we then had to look at what data is missing, what is unreliable. Also, if you don't have enough data in a certain area, that becomes suppressed because that can actually jeopardize confidentiality, or the data, there's just not enough data there to make, an inference about that. And so we will provide here in a minute some of that information. We also average the quartiles. So we did a quartile analysis to determine which quartile is ARD, which quartile is SVI-on, and then those two quartiles from each variable were averaged to develop a composite. We then conducted analysis to do maps for each state, which we'll show you here in a little bit, with counties using software called Tableau Public. Again, we don't have enough time to go through how to use Tableau Public today. We do have some great resources on our products page for using Tableau, but it is a free resource, and I encourage you all to use that. We then calculated the correlation of alcohol-related deaths and social vulnerability index using software called the Statistical Package for the Social Sciences, or SPSS. And we used a statistic called the Kendall's Tau B statistic. And this was the correlation statistic that met the assumptions for our data. We won't get into all those, but just know that that was the one that was chosen because of the assumptions that have to be met in order to calculate those statistics. And now I'm going to turn it over to Dr. Tremaine to talk about our findings.
Thank you, Nicole. Okay, well, here we have some tables. And so our two variables that we used for this study, and Nicole did an excellent job setting us up for looking at the quartiles and the values of alcohol-related deaths and social vulnerabilities index. So those are continuous variables. And what we're going to do right now is we're going to look at just SVI, the social vulnerability index. And as we reminded you in the chat, the social vulnerability index is a collection of 16 variables. Remember, housing and various ones like that, the socioeconomic status, household characteristics. And those 16 were averaged, and we came up with an overall percentage for SVI, okay? Now, in order for us to not have a map that has all of these colors, that would be very difficult to understand what is my county experiencing as far as SVI. We took all the values from the composite SVI score, the 16. We took those and we quartiled them, okay? And by quartiling, what that means is we separated them into 4 groups. Quartile 1 being the lowest. In other words, they experience not as bad of the SVI factors as the other counties, okay? Quartile 2 is getting a little worse outcomes there for SVI. Quartile 3 and quartile 4. Quartile 4 has the worst outcomes for, or excuse me, the worst SVI of all of the counties. So I'm kind of setting you up here to look at this slide and the next slide. What we have here, we have on the left-hand side is all of our states in the Southwest region. And so what you want to do when you look at this slide here is quartile 1 for Arkansas for SVI ranges from 10 to 11%, okay? Quartile 2 is 12, quartile 3 is 13, quartile 4 is 14 to 16. So those are the ranges of the SVI percentages, okay? And so you go down here and you'll look at Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. Now, do not make the mistake of thinking, well, quartile 1 in Arkansas, why is it different than quartile 1 in Louisiana or New Mexico or Texas? The data for each state is only using that data for that state. Okay, as opposed to across the nation, we would line up all of the states and they would all, if you will, compete with each other for their standings. They would be ranked against each other. Arkansas only has Arkansas data, okay? So you can see the ranges here from quartile 1 to quartile 4, okay? So let's look at now the alcohol-related, there we go, okay? If you will look at the ARD rates, you will see the quartile 1 and the quartile 4 here. Quartile 1 to quartile 4, you'll see Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. And so each one has the range. Again, here we're looking at the alcohol-related death rates. And so we look at the minimum and the maximum, and we quartile those, all of those values. And so each county in that state is given an alcohol-related death rate per 100,000. And so there's a minimum and there's a maximum. We quartile them. And here you go are the ranges for those quartiles, okay? And each county is given a value, remember. And so we line those up and look at their ranges, okay? All right. Go to the next slide. Okay, here are counties represented in the analysis. So here are the number of counties by state. And here are the values that were present. So you have to keep in mind that in the CDC Wonder that we were showing you or giving you the reference for that, in CDC Wonder, they do not provide values for counties that are less than 10. And they suppress those counties for confidentiality reasons. They also will suppress or counties that are less than 20 because they can tend to be unreliable. So they're not all counties in the state were used. There were some that were missing, unreliable, or suppressed, okay? So here we're providing these percentages, Data that is unavailable with 73% of the counties in Arkansas, of those counties that had a high enough value, they were provided. Okay, and so these are the percentages of those. So you can see for the different states here. Okay. All right, so here we get into a little more detail. So here is Arkansas, and I would like the Arkansans on the call to look at this map and look at our quartile 1, 2, 3, and 4. You will see that the missing, suppressed, or unreliable values, we don't have those. We can't get those values. Those are grayed out. And what we have are the quartiles. And you will see that there are distinct red counties indicating a quartile 4. That is the more concerning combination of social vulnerability index score and the alcohol related death rates. Okay. Okay, so here is Louisiana, and here are the combined scores or combined quartiles for Louisiana. You can see the red counties here. Okay. And please, in the chat, if you have experienced that, you've seen this particular issues in a certain county, please provide us some context for the slides for your states. Feel free to speak or to type into the chat. Here we have New Mexico, and you will see on the previous slides with Arkansas and Louisiana, there were distinct counties, separate counties. Here you see a little bit of clustering. So any of the New Mexicans on the call, feel free to let us know, is there any context for that? And remember, this is an average of the quartile for SVI and the quartile for alcohol-related death rate by county. Okay, that was New Mexico. Here is Oklahoma. And you can see, as I've been showing you, the counties of concern for Oklahoma. You can see some in the southeast, some in the central. And again, we have our quartiles. So what this is telling you is which states are green, blue, yellow, and red. Those are the quartiles. The quartiles 1 are green. That does not mean that we don't need to have interventions per se in that county, because they could, get in the future, there could be something that happens and they go up that quartile scale. Okay. And the last state here, Texas, you can see the counties that have quartile 4s. We've provided you with the counties that have quartile 4. And let me stop my video. It looks like somebody cannot see the screen. I hope that helps. You can see the quartile 4 counties here from Bexar to Victoria. Now, keep in mind, we are giving you rates per 100,000. You really want to pay attention to rates. If I were to give you only the raw numbers, and some of you may already know this, the raw numbers. Well, Texas has more population. It's a bigger state. And so you would not be able to compare there because you're just looking at raw numbers. So it's important that we are looking at rates when we're looking at these quartiles. Okay, that's Texas. Okay. And here are the findings and limitations. So there is a statistically significant relationship or correlation between SVI and ARD, SVI and alcohol-related deaths. It was significant at the 0.001 level. And so basically, where you're looking at here with correlation is if one goes up, the other goes up in this particular instance. And that is a significant relationship. A significant relationship or perfect correlation is a one. And this one, although not really high, it did indicate there was some relationship between SDI and ARD. Okay. And keep in mind, SDI, the way that they looked at the variables, the higher that SDI score, the worse it is. Okay. The combined ARD and SDI value is an average of the individual quartiles for ARD and SDI. So it is possible that for any given county or parish, the ARD and SDI are not perfectly aligned. So keep in mind that you might have a 3.2 on one quartile and a 3.8 on the ARD quartile, and there we rounded those, and so one would be a 3 and one a 4. And so what you want to do is look at the data and go into the data and look particularly at those special values so that you can get a sense of where those values landed. So remember, there were a lot of data points that were not available by each state. And we can't really do anything about that. That's why it's so important for you all to have the context for why things are occurring in a county and to seek help from other data sources. Okay.
All right. Thank you, Bev.
Yes.
Thank you for walking us through all of that and the analysis. And I hope that was helpful for you all to see that there is a significant positive relationship between alcohol-related deaths and social vulnerability, which suggests, there is an interplay, but because it was not a strong correlation, it indicates there's probably other things going on as well, which we know in prevention, it's always complex, right? It's never just one thing. So basically the findings kind of align with what we probably figured is that, yeah, it definitely is at play, but like we don't know that we can totally say that it's just social vulnerability that is having an impact on alcohol related deaths. So that brings us to talking about additional factors. We know that there are other factors at play that influence low or high outcomes. We need to use those upstream strategies to address our risk and protective factors. And for substance misuse and mental health disorders, our social determinants of health model, which is shown here, contains some additional factors that could be influencing our outcomes. The SDOH includes social and community contextual factors. It includes language and literacy skills, access to transportation, education, nutritious foods, physical activity, presence of violence, the list goes on and on. And so these are things that we need to pay attention to when we're doing our work. Also racism, discrimination, polluted air and water. There's a lot coming out about climate and how that can influence prevention. And so keeping an eye on all these things and really getting a good view of your landscape and your community for prevention is extremely important. We also want to look at if there is a lower SDOH, but there's a high alcohol death rate, what's contributing to that? What are the other factors that are going on? And the main thing is we want to encourage you to collect social determinants of health related data, because that is the key to being able to conduct a thorough community readiness assessment so that you can address social determinants of health. So this is extremely important. not just our risk and protective factors, but bringing in those social determinants of health when you're doing your community readiness assessments. So we would like to ask you in the chat, what are some ways you are addressing social determinants of health in your work currently? So what are some ways you're addressing social determinants of health in your prevention work? I'll give you a little pause there. And then as you're thinking about that, I will go ahead and move on because I know we have a jam-packed hour here, but self-care, great. Self-care is very important. Sometimes we forget about our workforce, right? And the things we need to do to also take care of our workforce. Yeah, self-care, great. And so while you are thinking about some more ways you do this in your work, I'll talk about some implications overall for your prevention work. So one thing we want to make sure we do as prevention professionals is we want to make sure we're identifying those data sources in our communities that look at those vulnerability factors, right? That's a big part of doing our assessments. That's a big part of what we do, and all those different databases that we take into account when we're doing our thorough assessments part of the SPIF. We also want to ask about barriers to accessing services. So do our clients have transportation to our services? Do they have childcare? We want to make sure we're making appropriate referrals. So it not just being about I'm having 10 students and their families coming to an after-school program to talk about alcohol misuse, but what do I need to do to help them get there? Not thinking about just the service itself, but how do I even get people here? What are the supports that they need? Another thing we need to do is encourage clinicians to implement patient navigator programs. And this is kind of on the same level, but talking about from the patient level, getting patient mentors, navigators who have been through these things themselves. How can they help walk someone through the process? So having that extra support, because sometimes people don't have family that can take them places or help them navigate through life, right? I was talking to my son recently because he turned 18, and doctors come in with like all these forms all of a sudden when you're 18 that you've got to know how to fill out. Well, if he doesn't have a mom there to walk him through that, how's he going to know what to do? And so when we have our clients who may not have family available, how do we help them walk through some of those things so that they can get equitable access to care? Another thing we need to do is develop and sustain coalition work at the local level to advocate policy change and implement strategies that mitigate the effects of social vulnerability. We also want to partner. So these are social vulnerability factors really extend beyond our typical prevention landscape. And so we want to make sure we're connecting with non-traditional partners. Are we talking to food banks? Are we talking to daycare assistance providers? And I see Debbie posted something about specialty courts. So yeah, all of those things that help you get where you need to get that sometimes we don't think about. Pay attention to intersectionality and involve a diverse group and population when you are adapting and tailoring evidence-based practices to reduce those barriers. So realize that evidence-based practices sometimes are specific to certain populations. And so make sure you're accurately adapting those to the populations you serve. Make sure you're working with a developer if you're working with an evidence-based intervention to make those adaptations. Build relationships with new partners that can increase community resources and readiness to support alcohol prevention strategies and address the needs of your vulnerable communities. So One thing we know we're good at as prevention professionals, we know how to build relationships. So that is something that is a strength. So in order to tackle social vulnerability in your communities and really make an impact when it comes to alcohol misuse, draw on that strength and really reach out and build those relationships with those non-traditional partners. All right. So wrapping up, I'm going to take a look at the chat here to make sure I didn't miss any great comments from you all. I see Catherine said we encourage taking mental health days and encourage healthy mental health to avoid burnout. For our community, we work with other agencies to meet the needs of the people. Great. And discuss multiple factors that are interrelated with youth substance use. We provide community-wide resource distribution that address these factors. Great. Provide a safe place for not only our clients, but ourselves too. Mobile units. Great. That's reducing that transportation barrier. And validating people's lived experience. Very important. Very important. And let's see, Kenya, yes, we will get the slides out to everybody that was on today's webinar. Bev also says the business community is an excellent partner that can help understand how alcohol-related issues affect people's work, personal lives, and economic development. Yes, yes. And there's a lot of new things happening with reaching out to the business sector and prevention and seeing how you can partner. Did you want to speak a little more about that, Bev?
Well, I know the disaster organizations and the government are really calling upon the business partners to, when we have disasters, what does the how's the business community and the owners and the people, how are they helping to make sure that the people are taken care of? They're at work, their families are somewhere else. And so in disaster situations, it's very important those workers have a plan for how they're going to work through that disaster with the employees, maybe at the business. And on the same side of the coin, there is how can the business promote the well-being of people in their community by looking at alcohol-related issues, because that affects their workers, their community, and they need to be a good partner in that process. So that's what I was meaning.
Great. And anything else that you all think of, you can post in the chat about how you feel like you can apply some of the findings from today in your work in the next month. So if you want to post anything, and Sheila's posted the question there, and that way we get an idea of how you see this applying to your work in your community and some things that are tangible that you can do. I see all the thank yous.
Thank you to state that we in the inner city, we went to all the liquor stores and asked them if they can open up later in the day instead of early in the morning.
That's great. Yeah, looking at the timing, and when is availability occurring? When are people accessing things? That's great. I also see contacting the military to be more involved within their community, because alcohol consumption is very big in the military.
Yeah.
Great point. Yeah. Great point. Well, thank you all for sharing. We're now going to talk about some of our closing items, but you all have been a great audience and participating. So I just want to say I appreciate that. And please hang out for the evaluation. So if you have any further questions, make sure that you post them here, and we can always get back with you later or answer that in the chat. And I'd just like to point out our evaluations. So we do take your feedback very seriously. You can scan this QR code with your phone, or you can click on the link which Sheila has posted in the chat under evaluation link It's a very short survey, but it gives us very good information about how we can improve and what else you would like to see from the PTTC. So I'll continue on, but you can access that link through the chat. We also want to encourage you to sign up for our listserv on our mailing list. Check out our website. We do have a new website, and we've been working on getting it all up to speed, but most of our products are there. If you experience a problem, just let us know. My contact information is nicoled@ou.edu. If you need anything after today's presentation, please feel free to email me. We also have a lot of products and resources, and you can search on our webpage to look at specific products. And we post all of our recordings there. We will send out these materials within a week, as well as our recording from today, but we will also post it on our website. And here are our references. You'll be getting all these, but those are our references for today's presentation. They're also in the data brief product. And then some resources. We gave you the links for CDC Wonder and SBI, but here they are again to emphasize the importance of these two resources that are free and available for you to complete your assessments for the SPIF as well. Just an awesome resource. So, and I just want to say in closing, thank you to Dr. Tremaine for all her hard work with our organization and on this data brief, and as well as Sheila Boswell for all the great design and graphics that have been incorporated. So, and Bev says you will get step-by-step instructions on Tableau Public with the resource Wanda gave. Making sure I didn't miss anything. Oh, Iris, thank you. Hi, Iris.
Hi, Iris.
I see lots of thank yous, and thank you all. We can't do this without you, so we thank you for your participation and hope you enjoy the data brief. Have a good day.